These children, playing happily, have been protected from extremely serious illness, disability, and even death from diseases that would have harmed or killed them if they'd been born 100 years ago. These are each highly contagious diseases that spread quickly and can cause severe illness, disability, and even death for some. Today, our children are protected from these harmful and dangerous diseases through a series of vaccines. Vaccines usually start at 2 months old and are given again at specific times during infancy, childhood, adolescence, and adulthood.
We're privileged. We live in an era of history in which we have these tools to prevent our children from suffering the consequences of communicable diseases. Younger people have not seen this. That's a good thing, and it's owing to the use of vaccines. But they may feel that the vaccines are no longer necessary because these diseases aren't around. We know from experience in other countries that when you stop immunizing, the diseases will come back and they will affect our children.
I would like to tell parents that doctors understand their concern and their worry about their children. We don't not only understand it, we relish it. That's the job of a parent. I think we need to help them get the information, understand the information, and we need to explain over and over again how important this vaccination program is to the health of their child. The problem is we've been hung out to dry because of our success. You have to be old. I saw children who were recovering or handicapped due to polio. I have seen children with meningitis throughout most of my medical career until the last 10 years who were brain damaged, deaf, suffered through meningitis. We used to see meningitis all the time, every week in the hospital before these vaccinations were widespread. It is such a pleasure for me not to see that anymore. It is wonderful. I think because parents don't see it, they don't remember how terrible it is. They don't maybe believe it existed. But polio and meningitis caused by various bacterial infections that we now treat with immunizations were real, and they were horrible. And we mustn't forget them.
Vaccines are also called immunizations and baby shots. Most vaccines are given by needle, which can hurt parents more than their baby.
Okay, guys. Now, Daddy, you be brave.
Oh, for sure.
I'll be brave, and you be brave. Okay? Hi, Amonia. Hi. Hi. What's up? Hi. Yeah, that's great. If the parents could stay calm.
Okay.
We got it made, because I'm calm. It is not unusual for a child following a vaccination to get a mild low-grade fever or a sore arm. You're putting fluid into the arm. So I ask my parents to give them some fever pain-reducing medicine before they come to the office. It has been shown to reduce this mild reaction. If the swelling continues or gets worse after 24 hours, we like to see the child and make sure there's no other inflammation going on. But they can generally handle almost all this minor effects of vaccination within the first 24 hours.
Vaccines protect against diphtheria, which infects the nose and throat and affects the heart, nerves, and kidneys. Pertussis or whooping cough causes severe, continuous coughing that lasts for weeks and may prevent oxygen from getting to the brain. Polio affects nerve cells in the spine, leaving muscles permanently weak, damaged, or paralyzed. Tetanus causes muscle spasms in the jaw, face, neck, chest, abdomen, and arms and legs. Tetanus germs are everywhere, and vaccination is the only protection. A booster is recommended every 10 years. MMR protects against measles, mumps, and rubella or German measles. Measles damages many parts of the body and weakens the immune system. Mumps cause fever, headache, and swelling around the jaw and cheeks. Rubella or German measles cause fever, sore throat, and swollen glands. German measles are far more severe in teenagers and adults. If a pregnant woman has German measles, they can damage her unborn baby's brain.
The vaccine that specifically frightens most parents these days is the MMR, measles, mumps, and German measles, with its association, wrongful association, with autism. And the data keeps coming in. There is no connection. They'll get the MMR vaccine at between 12 and 15 months. That is exactly the same time when a child is usually beginning to show some symptoms of autistic spectrum disorder. So these two, MMRs and autistic spectrum disorder diagnosis, are related in time, but not causally related. One did not cause the other. The same is true, of course, with pertussis and brain damage or seizures. Pertussis vaccine is given at 2, 4, and 6 months of age, and that's just about the time sometimes we see kids, children who are handicapped, starting to show they're not developing well.
Meningitis is caused by many different types of bacteria and virus, and which results in infection of the fluid and membranes that cover the brain and spinal cord. Hepatitis B is a liver infection which results in extreme tiredness, fever, and yellow skin and eyes. Pneumococcal disease can lead to pneumonia, blood infections, and ear infections. Influenza vaccine is a seasonal vaccine recommended annually for everyone, including infants starting at 6 months. The flu vaccine is especially important for children of any age with chronic health conditions such as asthma. The chickenpox vaccine also may protect against rare complications like flesh-eating disease and brain inflammation.
Vaccines are safely made, they are tested, they go through rigorous licensing procedures. They are as safe as a medical intervention as we have. And the reason they have to be safe is that we give them to so many people. And if there were side effects that were more common, they would affect many people. And so therefore we have to have a very, very safe product.
Routine vaccinations are highly recommended by all local, national, and international child health agencies, governments, and professional societies such as the pediatric societies and public health associations.
We have saved more children through immunizing them, vaccinating them. We have saved more children from becoming handicapped and disabled with vaccination than anything else that we have done in science and medicine.
It's important to maintain public confidence and to keep the programs going so that our children don't get into a situation where there are enough children who are unimmunized around that the diseases can spread.
By the time children are 3 to 5 years old, almost all will have caught a very contagious virus called rotavirus, which attacks the digestive system. Rotavirus is most dangerous for babies under 3 years old.
Rotavirus is actually quite common. As a matter of fact, everybody will get a rotavirus infection of some sort before the age of 5 years. However, about 1 in 100 infants will end up getting admitted to the hospital for their rotavirus infection from dehydration, and that's quite a high number. Infants are especially vulnerable when they get vomiting and diarrheal type of diseases. Because of their small bodies, they could lose water quite quickly, become dehydrated quite quickly, and become sick quite quickly from their dehydration.
The rotavirus has major impact on baby and parents since it can cause multiple bouts of vomiting, fever, watery diarrhea, abdominal or stomach pain.
Rotavirus infection can be quite serious for infants, as a significant number of them will end up having vomiting and diarrhea to the point that they will have to be admitted to the hospital and get intravenous treatment. So it's important that we try to protect infants especially from getting rotavirus disease. You're going to be protected by the rotavirus vaccine. The vaccine could have some side effects. It can give you a little bit of a fever, and it can give you some stomach upset. Here we go. Let's undo it. It comes as a nice liquid that's a little sweet and salty, and the baby just slurps it up right in their mouth. Even if the baby spit it up in small amounts, it still works quite well. With the introduction of the rotavirus vaccine, we are adding yet another vaccine to the baby's immunization schedule. Yet, the body can actually recognize over 10,000 individual vaccines being given to it and make antibodies for each and every one of them and have those antibodies available for when your child gets sick and really needs them. So there really is no upper limit to how many vaccines a child could get. And it does not increase the number of side effects for each child.
The rotavirus vaccine is given when baby is 2 to 3 months old, 4 to 5 months old, and again at 6 to 7 months old. The rotavirus vaccine won't protect a baby who already has rotavirus, and it won't protect against any other virus. But rotavirus is common, contagious, and serious, and that makes the rotavirus vaccine an important one for your baby. New vaccines are always being researched for the benefit of children, parents, and society.